1. Case study. Postpartum hemorrhage. Patient information. 30-year-old female, postpartum day 1, experiencing heavy vaginal bleeding. Vital signs. BP 90/50 millimeter of mercury. HR 120 BPM. Temp. 37.0 degrees Celsius 98.6 degrees Fahrenheit. 24 breaths per minute. Question. What is the nurse's priority intervention? Massage the fundus to encourage uterine contraction and reduce bleeding. Notify the healthcare provider immediately. Chest pain. Patient information. 55-year-old male with a history of hypertension presents with severe chest pain radiating to the left arm. Vital signs. Upper 160/90 mHg. CHAR 100 BPM. 22 breaths per minute. SpO2. 94% on room air. Question. What is the nurse's first action? Administer oxygen and place the patient in a semi-Fowler's position. Prepare to administer nitroglycerin and notify the healthcare provider. Study. Hypoglycemia. Patient information. 65-year-old female with type 2 diabetes. Reports dizziness and shakiness. Current blood glucose. 45 milligrams per deciliter. Question. What should the nurse do first? Administer 15 grams of fast-acting carbohydrate, such as juice or glucose tablets. Recheck blood glucose in 15 minutes. Case study. COPD exacerbation. Patient information. 70-year-old male with a history of chronic obstructive pulmonary disease, COPD, presents with worsening shortness of breath. Vital signs. BP 130/85 mmHg. CHAR 95 BPM. 28 breaths per minute. SpO2. 88% on 2 liters per minute of oxygen via nasal cannula. Question. What is the nurse's priority intervention? Increase oxygen flow rate as prescribed and position the patient in high Fowler's position. Notify the healthcare provider about the patient's condition. Case study. Preoperative patient. Patient information. 50-year-old female scheduled for surgery. NPO for 8 hours. Vital signs. BP 140/80 mmHg. CHAR 80 BPM. 18 breaths per minute. Question. What is the nurse's priority assessment? Verify that the patient has followed NPO instructions. Assess for any last-minute concerns or questions about the surgery.
Case study. Sepsis. Patient information. 45-year-old male with a suspected infection, presenting with confusion and fever. Vital signs. BP 90/60 millimeter of mercury. HR 110 BPM. Temp 39.0 degrees Celsius 102.2 degrees Fahrenheit. RR 26 breaths per minute. Question. What is the nurse's priority action? Administer prescribed 4 fluids and antibiotics. Notify the healthcare provider immediately about the signs of sepsis. Case study. Pain management. Patient information. 60-year-old female with osteoarthritis, reporting severe knee pain. Vital signs. BP 150/88 mmHg. HR 72 BPM. RR 18 breaths per minute. Question. What is the nurse's first action? Assess pain level and administer prescribed pain medication. Reassess pain level after medication administration. Case study. Anaphylactic reaction. Patient information. 35-year-old male with a known peanut allergy accidentally ingests peanuts. Vital signs. BP 85/55 millimeter of mercury. HR 120 BPM. RR 30 breaths per minute. SpO2 89% on room air. Question. What should the nurse do first? Administer epinephrine immediately. Prepare to initiate emergency airway management if needed. Study. Hyperkalemia. Patient information. 70-year-old male with chronic kidney disease presents with muscle weakness. Recent labs. Potassium 6.5 milliequivalent/L. Question. What is the nurse's priority intervention? Administer calcium gluconate as prescribed to stabilize the cardiac membrane. Notify the healthcare provider and prepare for potential dialysis. Case study. Post-operative care. Patient information. 50-year-old female, 2 hours post-op from an abdominal surgery. Vital signs. BP 100/60 mmHg. HR 110 BPM. Temp 37.5 degrees Celsius, 99.5 degrees Fahrenheit. Question: what is the nurse's priority assessment? Assess the surgical site for bleeding or signs of infection. Monitor vital signs for trends indicating potential complications.
1. Case study: urinary retention. Patient information. 65-year-old male with benign prostatic hyperplasia, BPH, reports inability to urinate. Vital signs: BP 140/90 mHg, char 88 BPM, 18 breaths per minute. Question: what is the nurse's priority action? Answer: assess the bladder and perform a bladder scan. Prepare for catheterization if ordered by the healthcare provider. Case study: stroke. Patient information. 70-year-old female with a sudden onset of left-sided weakness and slurred speech. Vital signs: BP 180/100 mmHg, chart 90 BPM, 20 breaths per minute. Question: what is the nurse's first action? Answer: call a stroke code and prepare for immediate CT scan. Monitor airway and vital signs closely. 13. Case study: dehydration. Patient information. 80-year-old male, reports decreased urine output and dry mouth. Vital signs: BP 100/60 mmHg, HR 105 BPM. Temp 37.3 degrees Celsius, 99.1 degrees Fahrenheit. Question: what is the nurse's priority intervention? Answer: administer prescribed 4 fluids. Monitor for signs of fluid overload and assess hydration status. 14. Case study: anxiety. Patient information. 25-year-old female with generalized anxiety disorder presents with shortness of breath and chest tightness. Vital signs: BP 130/85 mmHg, char 110 BPM, 24 breaths per minute. Question: what is the nurse's first action? Answer: provide reassurance and guide the patient through deep breathing exercises. Assess the need for anti-anxiety medication as prescribed. 15. Case study: medication error. Patient information. 50-year-old male was given the wrong dose of a prescribed medication. Vital signs: BP 120/80 mmHg, char 75 BPM, 16 breaths per minute. Question: what is the nurse's priority action? Answer: assess the patient for any adverse effects. Report the medication error according to facility policy. 16. Case study: respiratory distress in a pediatric patient. Patient information. 6-year-old male with asthma presents with wheezing and difficulty breathing. Vital signs: BP 100/60 mmHg, HR 120 BPM, 30 breaths per minute. SpO2, 90% on room air. Question: what is the nurse's priority intervention? Answer: administer a bronchodilator via nebulizer as prescribed. Reassess respiratory status after treatment. 17. Case study: blood transfusion reaction. Patient information. 45-year-old female receiving a blood transfusion, reports chills and back pain. Vital signs: BP 90/50 millimeter of mercury, char 110 BPM. Temp 38.5 degrees Celsius, 101.3 degrees Fahrenheit. Question: what should the nurse do first? Answer: stop the transfusion immediately. Notify the healthcare provider and monitor the patient closely. 18. Case study: postpartum depression. Patient information. 28-year-old female, 4 weeks postpartum, reports feeling sad and overwhelmed. Vital signs: BP 120/80 mmHg, char 78 BPM, 18 breaths per minute. Question: what is the nurse's priority assessment? Answer: assess the patient's mood, thoughts of self-harm and support system. Provide resources for mental health support and notify the healthcare provider. 19. Case study: Fluid overload. Patient information. 75-year-old male with heart failure presents with shortness of breath and swollen ankles. Vital signs. AB 150/90 mHg. Chart 90 bpm. 22 breaths per minute. SpO2 92% on room air. Question. What is the nurse's priority intervention? Answer. Administer prescribed diuretics and monitor urine output. Elevate the legs and assess for further signs of fluid overload. 20th case study. Hypotension. Patient information. 68-year-old female with a history of hypertension presents with dizziness and lightheadedness. Vital signs. BP 85/55 mm of mercury. Char 72 bpm. 18 breaths per minute. Question. What should the nurse do first? Answer. Lay the patient flat with legs elevated to improve blood pressure. Reassess blood pressure and notify the healthcare provider.